My name is Joseph Flesch. I'm one of the founders of Purple Binder, and I was here speaking on a panel about digital health startups. Purple Binder is an app for hospitals, health systems, insurance companies, and what it lets them do is match their patients with all kinds of community services that address like the economic and behavioral and social factors that impact someone's health. And those are services like food pantries, mental health and substance abuse treatment, subsidized housing, low-cost childcare, low-cost healthcare even. These are all things that really have an impact on someone's health, but they're not necessarily always addressed within the current medical system. What I was talking about today on the panel was that when you design in healthcare, right, you need to design to solve the daily pain points of your end users, to design your core product. But in addition to that, there's a whole host of other problems that you need to design for, because when you create a healthcare product, your end users are almost always not the same as your customers. So you need to design for the deployment of your product within this much larger healthcare organization. And to do that, you need to design not just to address the endpoints of your users, but also you need to design a sales process. You need to design a setup and training process. You need to design a support process. You need to design for the value that a manager is going to get from their employees using your product. And all of these things are in addition to designing the product itself. What volume to value means to me is that it used to be that insurance companies, Medicare and Medicaid, basically just wrote blank checks to healthcare providers. And now healthcare providers are being allotted a fixed amount of money to care for each patient, and they only make money if they save money by keeping people healthier. And Purple Binder really only could exist within that context, because the reason that hospital systems and insurance companies buy our app to use with their patients is because they are incentivized to keep their patients healthier. I think that up until this point, there haven't been enough incentives for really amazing design to be incorporated into the healthcare system and into all the processes that go into caring for somebody. I think that with the transition from volume to value, there are really an incredible spectrum of opportunities to incorporate better design into experiences for patients and providers, and I'm really excited to see what that looks like going forward.